I'd like to call the meeting to order. If you would, please join me in the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord, you and the citizens of Orange County have entrusted us with leadership. Help us to share ideas and plans with each other. Keep us kind and courteous to one another and to those who come before us. Give us insight to the work at hand that we may further your guidance and benefit the people. Help us to not forget the needs of all. We ask in your name.
Okay.
That's pushing it too far, I think.
So we have the one change to the agenda, which is the deletion of 3B Life-Saving Awards. Are there any other changes or modifications?
Move to approve as amended.
Second.
All in favor, say aye.
Aye.
Carries 5-0. That brings us to special presentations and appearances. The first would be service awards. Brian?
Yes, sir. I'm pleased to, spot on the agenda, I'm sorry.
Should I go to give something away? or-
Yes.
My name wasn't in
I need to get to my place in the
Walk
agenda and
slowly.
you'll get to your spot on the floor. Mr. Chairman, I'm pleased to offer for your award, recognition, the following individuals for their service to the county. Donna Sears, 10-year service award, Circuit Court Deputy.
Thank you.
Jason Meckel, 5-year service award, OCAS caretaker.
You're welcome. Thank you. Thank you.
Suzanne Sullivan, 10-year service award, Orange County Office on Youth Administrative Assistant. She's finding money on the way.
Thank you.
And last, Barbara Crozier, 15-year service award in the building department. Also being recognized but not able to attend is Susan Harner, 15-year service award, Orange County Sheriff's Office SRO officer.
Did I reseat myself?
Yes, sir.
Thank you. Okay, next then is the business spotlight with Sherry or C.E. Lutz from Matty Bugs Gifts and Decor.
C.E. didn't make it, but I did. And I come bearing gifts as well. I'll just set them over here for any.
Gifts are good.
Well, public speaking is not my forte, so
We
please
will
bear
forgive
with
you
me.
now.
Thank you. Well, good afternoon, and thank you for inviting me to Business Spotlight. My name is Sherry Lutz, and I am the owner and sole proprietor of Matty Bugs Gifts and Decor. We are located in the Orange Park and Ride Shopping Center next to Schul's in beautiful downtown Orange. Matty Bugs is a retail specialty gift and home decor store, and it's named after my beautiful little granddaughter, Madison. We opened in late August of this year, and I'm proud to say that I am doing very well, and that is something that needs to be said because so many businesses in town are just struggling to get by, and we've been here before with a different shop, and we did very well then too, but due to family reasons we had to close, and now we're back in business. And Just happy to be here, back in Orange. And Maddie Bugs offers gifts for almost all occasions. I'm sorry, guys, we're not into the men yet, but we're getting there. My husband wants to do a sports section and a hunting section with decor and things, so just bear with us. And we have seasonal and primarily country home decor. We also offer handcrafted items from local Orange County citizens, such as jewelry, scarves, purses, hair bows, floral wreaths, and arrangements. Our regular business hours are Tuesday through Friday, 10 to 6, and Saturday, 10 to 4, and beginning this Sunday, we'll be open through the Christmas season from noon to 4. So when you need a special gift for that special someone, or a picture to put on your wall, or right now a snowman for your holiday decorating, I invite you to please shop Maddie Bugs Gifts and Decor. Thank you. Do y'all have any
Thank you.
questions?
Yeah, just let us know when you get talking fish in there, and we'll come see you.
Talking fish?
Talking fish.
Like the little bass guys that sing?
I had someone give me one of those, I gave it back.
Well, thank y'all very much for allowing me to come, and I hope to see you all. Have a Merry Christmas.
Thank you.
Thank you. Okay, next we have the presentation of certificates of election, members of the electoral board.
Well, we're having somewhat of a problem. So I don't have the certificates, and Joanne, the secretary, doesn't have them. So can you bear with us?
Certainly, we'll
Find out what's going on.
I'll move on to the next thing and give me a thumbs up when you're ready to go.
Nice knowing you, Mark.
I'll stay the rest of the meeting.
Yes, okay. The person with the certificates thought the meeting was at 6, and he'll be here in 10 minutes. So can we put it off for a little bit?
That's fine, we'll move on and come back. Okay, next would be the annual report card on the Orange County Health Department, Dr. C. Ann Davis.
Mr. Chairman, members of the board, Mr. Administrator, and the wonderful Allison Simpson, as well as the citizens present here tonight, I stand to present to you the public health report to Orange County. I'm feeling very brave this year. I thought I'd try a PowerPoint. Last year I just gave you handouts, and I think about a year and 1 month ago we were at Lake of the Woods having this meeting. So I will invite you to follow along on this handout, which will certainly require reading glasses, for me anyway. I will draw your attention to this very busy-looking worksheet, which summarizes about a third of the services that we provide. You will see that it includes outcome measurements and total cases for several services. We provided, between our communicable disease control, our immunization, our environmental health protection for this county, to prevent and control diseases, providing a total of over 1,600 services. If you look carefully at this, you'll see we're having an unusual number of tuberculosis control interventions. Quite a bit of latent TB has been discovered. In medicine, we have a phrase we use as a shortcut in charts called WNL. I used to think it meant within normal limits, but now I think it means we never looked. If you don't test, you won't find it. And we now have some excellent treatments for latent TB, and we are discovering them on a regular basis and doing aggressive contact follow-up. We did quite a few visits for STDs and HIV testing services, which I'll review with you. We provided 465 immunizations, and we're actually on track after the first quarter of the new year to provide even more this year. Our environmental health services are up. Our reimbursed environmental health services are down. There's less new construction. I don't think that'll be a surprise to anyone here. I'm happy to report that although we did many rabies exposure investigations, 81 in the last fiscal year, and already 19 to date this year, we found very few cases of rabies, which I'll demonstrate to you shortly. On the next page, you will see a list of the communicable diseases that we assessed and a comparison to the number of cases in previous years. A couple of things worth pointing out on this slide. It does not include tuberculosis, it does not include HIV or sexually transmitted diseases, which are reported and handled separately under Virginia Department of Health reporting. Pertussis or whooping cough is a huge local problem. It's very underreported. In people who've been vaccinated, it's likely to be milder and can therefore spread to vulnerable persons such as very young children and older people or people who are immunosuppressed pretty easily. So I would like to urge the board to support vaccination of anyone eligible and revaccination at least once in adulthood for all adults. Next time you need a tetanus shot, get a Tdap, which will include pertussis. Tick-borne illness is still a concern in our area. Many care providers are now simply calling in prescriptions for antibiotics and not testing for it, so it's quite underreported. You can see we have what looks like a drop in our Lyme disease rate this year. Three cases year to date, which is equivalent to the last full calendar year, because you never know what will happen in the last month or so, and a couple of cases of Rocky Mountain spotted fever. Varicella or chickenpox is also quite underreported, and we are seeing more hepatitis too. I think there's an increase in IV drug and drug for sex activity, and hepatitis is coming with it. Lead is another issue. You can see, fortunately, we have very few verified cases. It is tremendously damaging to young children, and it is still a problem in our district. Traditionally, we've thought about it as a problem in old water systems with old solder, in older homes built before the early 60s, in which old paint is chipped and eaten by children or peeled and sanded and aerosolized. But actually, a couple of the cases that we've pursued this year in this county and others really are the result of people handling firearms, shooting quite a bit, loading their own shot. The dust from the lead is on the floor, and children who are still crawling and playing on the floor will get it on their hands and body and ingest it. So that's something worth thinking about too. On the next page, this is the total number of outbreaks that we investigated this year. There are very few. It included a norovirus outbreak in a long-term care facility, an influenza outbreak in an outpatient clinic, and a respiratory illness of unknown type in an elementary school. Just to recall the definition of an outbreak, it is an episode in which two or more persons have the same disease, have similar clinical features, or the same known pathogen, thus meeting the case definition, and there is a time, place, person association among these persons. You will note that on this illustration, we have hand washing. I would like to point out that among our reportable diseases, you can practically prevent all but two of them with good hand washing habits. This includes using soap. It really doesn't matter what kind. It is the detergent action of the soap in releasing the surface gripping capability of bacteria and viruses, and the rinsing that goes with it that does the trick. It isn't really a matter of buying something fancy or expensive. You should be able to sing a verse of Happy Birthday twice while you're washing your hands for it to be sufficient. Do practice this at home.
taught me that.
I never knew that trick until I joined the health department. Now here is some really good news. Remember we checked out 81 potential high-risk rabies exposures. We only had 2 actual cases of rabies this year. And this year we did not have bobcats, llamas, or goats. We actually had just what you would expect, which is 1 raccoon and 1 fox. I will hasten to remind the board and the public that at this time, cats have surpassed dogs as the domestic source of rabies. It is very important that people not entertain, play with, and hand feed feral cat colonies, which is unfortunately a common practice, and it's very important to remind people not to attempt to befriend, pet, hand feed, or touch wild animals. If they're acting friendly towards you, it's very unusual, and there's a much higher chance that they have rabies. We have a pretty high hit rate on our submitted raccoon specimens in all of the counties this year. On the next page,
So you're saying that, that normally a feral cat won't come around you, but if a feral cat does, then you need to be more nervous about that, because that's an abnormal behavior for them.
well, a feral cat's a tough thing because a lot of them started off domestic, so they go to people for food. So it's harder to tell if their behavior is abnormal or not. And cats tend to be aggressive when they're hungry, so they may be very friendly and then give you a good bite to show what it means to them after you feed them. And they're hard to catch and identify. Dogs are a little easier to track down, pen up and observe, or test if necessary, but cats are harder, and it results in a lot more unnecessary treatment of people.
What kind of programs do you have for educating the public about these?
Well, we communicate regularly with the newspapers during National Rabies Week. We did several articles. We also had a radio broadcast that was featured in Culpeper and Orange that reviewed all of the health department functions and invited the people from the Culpeper office to come through and give a quick talk about what they do, and we emphasized rabies prevention at that time as well. We work with the public libraries to make materials available. I'm also interested in things that you all think would work and be useful in your community. I think what helps people with public health literacy is very setting dependent. So at the health department, we're interested in your opinion. We'll try just about anything. We'll send nurses out. We'll go to the schools. I think probably teaching children not to do this is a great idea, because I doubt that most of their parents will listen to us.
These positive results were just to clarify that those were tests from human tests. What about the?
No, these are not from human tests.
These are the animals themselves.
Right. We have no human rabies in Virginia at this time.
That's what I thought I heard.
And we do not want the first case.
Okay.
So we're very aggressive about
So
following
these
this
These
up.
are animals.
These are animals.
Picked up by animal control that,
Animals tested, yeah.
and were tested and found to be rabid.
That's correct. And very few out of the ones we investigated. That was a great relief.
Let me see. How many did you investigate?
81,
Okay.
I believe that's correct. It's late in the day?
said
Yes, it
earlier.
is. Okay. All right. Now, on the next page, you'll see our second overarching goal at our local health department, which is to improve the health of women, infants, and children. Not counting the very large number of clients that are served by the Healthy Families Program and the Women's, Infants, and Children's Program called WIC, we provided over 1,300 services in the last year in your county. This included family planning and pregnancy prevention, counseling and education on self-care, always included. Non-smoking counseling is included. You will see on this slip the number of family planning visits. We had a total in the fiscal year 2014 of 537 visits, and we're off very slightly in the beginning of the quarter from where we were in the first quarter last year, but I anticipate we will catch back up. We're especially interested in capturing male clients because we do have advice for them. Something a lot of people don't realize is that very young men and boys are eligible for human papillomavirus vaccine the same as girls. It can be given as young as age 8. Around 11 is optimal. The later you wait, the greater the chance that they've become exposed to human papillomavirus, a virus that causes warts in humans and of which several subspecies can cause cancer of the oropharynx, mouth, anywhere along the genital tract, and actually can arise in other areas as well. We're starting to see some lung papillomatosis and mouth cancer now. So The nature of it is changing, and the prevention is tremendously important. We have a very poor uptake rate right now for HPV vaccine by boys. It'll be a matter of parental perception and of capturing young men before they've had many contacts as they get a little bit older as well.
Are
Healthy, sorry.
Are primary care physicians beginning to have that discussion with, or pediatric, whichever?
We are writing to them, speaking to them, presenting at hospital meetings. It requires a cultural change because I think physicians, for the most part, are not oriented towards remembering to provide that for males as well. Also, the vaccine can be a little expensive. We have had a small supply of free vaccine, which we have pretty much used up at this point, but I can try to go to, if we come up with a group of people that want it done, I can see what I can do to make it affordable. One thing about vaccines at the health department, we can't do them free if you can afford them and you have insurance, but you will never be charged more than our cost. So it's hard to beat that deal. All right. The Healthy Families Program, which comes to you separately for funding and which receives a subcontract of national funds, is not included on this case list. So where you see zeros for Healthy Families, that is not correct. They actually performed 88 family screenings and provided an ongoing home visiting program for now more than 13 Orange County families. The families have to agree to have that done. It can begin before babies are born and go through age 5. For young children, it helps support appropriate parenting practices. It's intended to decrease early childhood neglect, injury, family violence, and improve baby sleep hygiene. I don't know if you've heard much about the push in Virginia to decrease infant mortality. We're already lower than the national average, but unsafe sleep practices play a major role. It's estimated that young babies are put on soft bedding about 55% of the time currently, and this cross-cuts education levels, parental knowledge, and everything else. It is really important for babies to sleep on hard surfaces without extra sheets, pillows, soft toys, all the things you think of filling a crib up with. And you can prevent concerns about having a flat back of the head or something like that by letting the baby have what we call tummy time while they're awake. But safe sleep is a huge push, and it's really important that we get that across. We collaborate with several other organizations in supporting that. I think your representatives from the Department of Social Services will be aware of that. Car seats are still distributed by the health department. We also distribute cribs to help support safe sleep. They're collapsible and portable, people who don't have access to such things otherwise. And we are having a good success providing prenatal care visits. We provided over 358 prenatal care visits during the year of 2014. This means almost all of the mothers had multiple visits at appropriate times, because certainly that many people did not deliver. Now, a word about labor and delivery. In the nation, teen pregnancy rates have fallen. They're below 11% in most areas. I regret to share with you that Orange has a rate of 16.5%. Now, that can be misleading because there aren't that many teen pregnancies. There were 34 in the last fiscal year, and 30 of those were between ages 18 and 19 and a half and reported that their pregnancies were on purpose in a long-term relationship. So I don't know if there's a new fashion for early mating or what's going on, but we'll keep an eye on that trend. With numbers like 30 and 34, 1 or 2 people can really change your percentages. So I don't think we'll get too excited unless we see about a 20% difference. The Women's Infants and Children program is serving about 500 women, infants, and children at any given time. They are subcontractors for federal funding administered through the Virginia Department of Health and several other agencies. They provide thousands of dollars in supplemental food and money to buy assigned appropriate nutritious supplemental foods, and provide thousands of dollars of income for our local merchants, and require absolutely no cooperative budget funding from you. Same thing for Healthy Families. Although they do approach you for some funding support because their national program funds have been cut and they do good work, their main budget is not supported by the co-op budget. So we have a variety of functions we do that are not in the co-op budget. That goes for emergency planning too, which we'll talk about a little bit too. Now we come to sexually transmitted infections in Orange. There was a time when I thought we wouldn't see any more syphilis, but unfortunately it has come back. Chlamydia is a huge problem. It looks, it's much higher than you might think, because 98 at this point in 2014 means there's going to be more before 2014 is over. Chlamydia is a bacterial infection that is the leading cause of blindness in the world. In this country, we have the good fortune to place antibiotic ointment in the infant's eyes. However, that does not prevent dangerous pulmonary infections that can sometimes be fatal. It's really important for parents to be in prenatal care, for partners to be treated. Again, identifying and treating male partners is very important. And I am making arrangements. I've brought incubators back into the health department. We're going to aggressively restart culturing for test of cure on chlamydia and gonorrhea, because we have way too much of it locally. We think that drugs for sex is probably part of the dynamic of this. We do have a couple of people in the county who have declined to take therapy, even though they're known to be infected and at high risk for blindness, arthritis, and other complications of late infection, and their partners are being treated but reinfected regularly. We're at high risk to be breeding resistant bugs and we're running out of drugs. So that is a problem. Last year we had 3 new diagnoses of HIV in the county and 1 that progressed to AIDS. So we kind of had a reversal of our statistics there last year. They're very small numbers. I consider these to be about the same number. Goal number 3 is to prevent and control chronic diseases. Believe it or not, that's what it says. We have selected outreach programs which are measurable. We are working with one-on-one with representatives from the Department of Social Services to provide something that is routinely called nursing home pre-screens, but is really a screen of people of almost any age to decide whether they can handle expected activities of normal daily life and self-care. We are having a rising demand for those services, and not just among the elderly, although the rise of the elderly population is a factor there. So you will be seeing those numbers go up quite a bit. As you can see, first quarter of the fiscal year 15 compared to last year, well, we already have quite a pop up, 240%, and it's not going to get smaller. We've provided quite a bit of outreach and education, and in fact, whenever we investigate a reportable communicable disease or an outbreak of a disease that might not be reportable, but we try to prevent it from spreading very far, such as norovirus and other enteric organisms, which can wreak havoc in schools and long-term care and daycare facilities. We take that as an opportunity to do education on prevention, hand washing, the manner of transmission, care of family members, other preventive measures. Last year, our outreach and education services included a standing member on the Orange County CPMT, which is the Community Policy and Management Team, which is designated under the Comprehensive Services Act. We provided seasonal campground readiness materials to all of our campgrounds, and in fact, we put together a guide of very high quality for pre-season preparation that we hand-delivered, reviewed with the staff ourselves, and distributed to the entire state of Virginia. to all of the health directors in all of the districts to help keep people from dragging ticks to you and other illnesses which can occur in camps, because camps are a major site for waterborne and foodborne illness because of the activities there and the lack of hygiene which can occur. We collaborated with area school systems to provide information, infection prevention, and service support. We offered focal vaccine clinics where needed. We participated in area health fairs, some of which were run by the faith community. We have a growing list of collaborations there. And very big deal, we were major collaborators with the Culpeper Medical System in performing a community health needs assessment which covered Culpeper, Orange, and Madison. They recently had a follow-up discussion about their findings and invited key informants from the community to talk about current assets in the community and current deficits in the community to address some of the key issues. Tonight, I've taken the liberty of doing something a little different with our annual report. I decided to review with you how the county ranking system pertains to the county. First, I will add one more service that we've provided, and that is emergency planning services. Our fiscal year 2014 Orange County services have included collaboration with the Medical Reserve Corps to provide incident command series, education and preparation, and other emergency response, collaboration with MRC staff for health fairs and community events. In the last fiscal year, we also provided a mass vaccination exercise in the county of Orange. We recently collaborated with Orange County government, law enforcement, emergency management, and Department of Social Services partners to assure Ebola planning and preparation for your county. That was a very good meeting, I thought.
Yes, we all came out of there educated on Ebola.
Yeah, and it's the thoughtfulness and how we collaborate is the secret.
Does the health department have an adequate supply of personal protection equipment?
It's funny you should ask. The hospitals in our area do. We don't have much money, so we have one or two suits at each office, but we teach other people how to put them on and take them off. So we're educating the people that have the equipment, and they have kindly offered to loan us equipment if they need to. We currently have an active monitoring program for all travelers coming from the 4 countries which represent a risk. That is Liberia, Sierra Leone, Nigeria, and now an adjacent country, which they are allowed to come into the U.S. through only 5 airports. One of them is Dulles. JFK is the biggest and busiest. The next one is Dulles.
Do we know if any coming through Dulles or have an endpoint in this area?
Well, because of patient privacy protection and the relatively sparse population, we will collaborate with your county management if there is someone who is a risk to the community. I would like to quickly mention that Ebola is not contagious until it's symptomatic, and that it depends on the amount of virus that's shedding, so the person has to be relatively ill. I will say that in the surrounding districts, there's been a pretty heavy number of people who've been followed. I have been forwarding to Mr. David on a regular basis our situation reports from the health department that track the number of people who are being followed, who finished their 21-day follow-up period,
So we do have people who are in our vicinity.
You
They are
have
coming
people
here,
who are not far
being
away,
monitored.
being monitored, okay? But at this point, there have been no cases of Ebola in Virginia, and no one that we've been monitoring has become ill.
Okay.
And it involves checking in twice a day. It's a pretty careful program. I'm pretty happy with the way things are shaping up there. And I would like the public to know that your risk of catching Ebola is documented to be less than your risk of being eaten by a shark here in Orange County. So I think the likelihood we'll have people that we follow and that we take precautions with is high. I think the likelihood of actual Ebola is low. I think with the flu and cold season, the likelihood somebody's going to get a fever and that we'll have to take precautions is high. I'd also like to mention that these patients from these endemic areas are 40 times more likely to have malaria than they are to have Ebola, and it has almost the same symptoms. And typhoid's the second thing that has to be ruled out. So along with the requirement that one has traveled or been heavily exposed to someone from an endemic area and have the fever and other symptoms, it's also necessary to rule out the more common causes of febrile illness that can cause dehydration. So there you go. Now, I did forward to this county your own version and special statistics from the County Health Rankings Report, I guess around February this year. And I will try to make an interpreted version that's fairly easy to go through for each county in our district each year. It involves playing with a lot of background statistics. The good thing about the Robert Wood Johnson Foundation funded County Health Rankings Report is that it's done in every state in the Union, and it's done in every independent city and county in the United States. You cannot compare the rankings across states because it's a ranking of counties with regards to each other. Also, although they have fairly broad categories, the things that are measured to give scores in those categories change somewhat every couple of years, so it's even hard to measure year to year. But I will follow through with you on several of those things. The other good thing about the County Health Rankings Report, it does allow the identification of areas that will require policy change. It does support the concept of community preventive health and health in all policies. In other words, when policy decisions are being made, whether it's construction or traffic control or anything else, that is the time to think about accident, injury, and illness prevention. Not later after everything's a structure and we have to deal with whatever comes. The Virginia Health Rankings Report recognizes that community health is multifactorial, includes individual behaviors, quality of health care, education, jobs, and the environment. It's a very broad guide. The numbers for less populous communities like ours have a greater margin of error, and it's more difficult to measure change. But you can definitely see trends and rankings with respect to other counties, very telling, I think. So
I'm looking at this. What do the rankings mean?
Well, the counties are all ranked based on a set of Z-scores.
I understand, but I'm just saying, when I look at a number, say health outcomes is for 2014 is 40, and I guess is that 40 a good number or a bad number?
Well, I'm going to walk you through that.
Okay.
All right. So the reason I left this slide with very tiny print that you have to squint and see is because it's a combination measurement. So overall, your county measures 40 in the state out of 133, with smaller numbers being more favorable. So before you congratulate yourself on that, I would like to take this down further and show you some of the subcategories that went into this. There's a star by some of these indicators, meaning the way they're measured changed over the years. It's very easy to go online and see a much easier to see version of this. For anyone that would like to see this closer up, I can produce a hard copy for you that's a little bit bigger and more legible. But I wanted to leave this before you because it looks like we have red 40s and 50s and 30s all over the place, which makes it look like our rankings are fairly favorable. However, if you take a closer look, I think you'll find some things that can advise county health policy decisions and also guide us in areas we can explore solutions for together. That is the health factors categories. So So a big problem is diet and exercise. Orange County actually ranked 92 among 132, not 40. Of the 26% of residents reporting inactivity, 57% reported they had easy access to exercise and gave no particular reason why they did not do it. 33% of Orange County adults are obese. Considering that people usually underreport their weight and overreport their height, I'm guessing that this is probably the tip of the iceberg.
Where-
I've done it.
Who did you get your data from?
I got it from the county health rankings. It turns out,
But who did they get it from? Did they go out and solicit residents, or did they survey people coming into the health department?
there's a combination of sampling, there's a combination of use of national census data, data from national health surveys such as NHANES. If you go online, there's a wonderful list of all the places they went to get their information. The other thing that's really helpful about this is that actually in Virginia, the Virginia Department of Health oversees the compilation of these statistics for you.
So there's a weighting of data
Yes,
from
there's a weighting of data.
number of different sources. Okay.
Yes. Major physical inactivity factor is long commutes to work. Orange County ranked 95 for both driving alone to work in combination with long commutes to work. Alcohol use and driving with alcohol use are also a fairly significant problem. Orange County ranked 68 for self-reported alcohol abuse. Since lots of people don't think they have a problem, we might actually be higher. 18% of adult residents reported drinking and driving.
Are they the ones with the long commutes?
I don't know. This one didn't do too well, as you can see. 24% of county driving deaths are related to alcohol impairment. That is a really frightening statistic, and that is not pulled out of a hat. That's the real stuff, based on autopsy and other testing and death certificate information.
24%
Of driving deaths
driving deaths.
are related to alcohol impairment.
So 1 in 4.
How many did we have?
And it doesn't have to be the driver.
You say this is bad. What would a national or a state average be?
I'd like to see 0, of course.
I know, but what are we talking about?
Yeah, I think you want to really see your numbers and get down in the teens and in the low teens. Areas that are doing well are lower than that. A big challenge is diabetes. 12% of Orange County residents are diabetic. 10 to 12%, 12 is high as the nation goes. 10 to 11% is where most of the country is right now. Primary prevention includes correcting obesity and inactivity early before diabetes becomes manifest. Not all diabetes is caused by personal behavior, but most of it is associated with food and exercise habits over time. Primary prevention means that we help improve people's health and take precautionary measures before any disease is detected or diagnosed. Secondary prevention, a disease is recognized but controlled in very early stages to allow good quality of life. Tertiary prevention, disease is very manifest or advanced, such as cancer that has spread. That's chemotherapy and things like that are tertiary prevention. When you get people with tertiary prevention for diabetes, they already have permanent changes from the disease, and we're just trying to do damage control and help them have a decent quality of life. Secondary prevention requires control, awareness, reflected by people with diabetes monitoring and knowing their hemoglobin A1C levels. They need to be low. Diabetes can be diagnosed based on the hemoglobin A1C level. It should be 6 or less in diabetics with good control and in people who are not at risk. Only 89% of Orange County diabetics know and monitor their hemoglobin A1C levels. The county ranks 61 in the country. disregard for prevention and good monitoring standards is a problem all over the country, but we're a little bit ahead. You see I have my test tube with wings there. I hope it'll take off. Another challenge for our county is what I call the social insecurities. 16% of Orange County residents are uninsured. That's 19% of adults and 8% of children, considering that the bar is very low indeed for insurance assistance for children. That's still a pretty scary number. Really sad is 14% of Orange County children are living below poverty level. In the country, the average is between 10 and 11%. 11% of Orange County residents are food insecure. What does this mean? They're not sure that they will be able to afford and access healthy food to protect their health. No one feels that there's a shortage of healthy food access, so food insecurity is more about physical ability to obtain the food and money to afford the food. I put this figure with a question mark on its forehead because I don't have all the answers for these problems. The answer is not going to be the same in every community, and what needs to be done may change over time. When a problem is massive, impressive results can be had from interventions. The trick is cleaning up the smaller statistics, such as we're seeing in trying to help continue teens stopping smoking. So, I put some email some websites addresses for you here if you want to go delving into countyhealthrankings.org. If you would like a greater detail of statistical information, I can provide you with all of the background materials I've received from the health department. And actually, I believe Mr. David, somewhere in your old email, you may have that. I can resend it from back in February.
Please.
Yes, I don't know about you, but February's a long time ago on email.
You mentioned that there were the possibility of county policies that could have an impact on this.
Yes.
Would you like to?
Well, I think that would be a whole nother talk, but some quick things. I think promoting healthy lifestyles, making it easy to be physically active in the community, providing things that are healthy and useful to eat at events, improving hydration for county residents, trying to reach people early to get them to adopt behaviors like not driving drunk or using alcohol before they try to approach other drivers. There's just so many things that we can do. And
But these are all educational.
No, education, it's sort of like a pyramid. Education's at the very top, but cultural change is at the bottom. What people believe to be true, what they think is useful, what they think will help. And I will give you a good example of urban legend. How many radio programs and newspaper articles have you seen poo-pooing the new healthy lunches that are supposed to be served to children in school, talking about the kids being hungry, that they throw away the fruits and vegetables and nobody eats them? Well, I know for a fact, I don't know here as well, but I know for a fact in Culpeper County that their food service is self-supporting, it is following all of those guidelines, and the guy that runs it looks like a champ and eats that lunch every day himself. The kids are eating the healthy food. They're interested, they're being taught about it. We need adults to help reinforce that. We need to improve public health literacy. It's really not about telling people what to do, but helping them understand the choices they make and that they are choosing for themselves and have to live with the consequences of their choices. These are the things we have to build towards. If you're interested as a body in me doing research and showing what's worked in some other communities that look not unlike ours, I will be very glad to do that. I am at your service, and so is the rest of our district. And now I'm open to questions if anybody has any.
You have any further comment on the TB? I seem to hear you say that it was a result of more or better testing as opposed to...
Well, it's interesting because you always think of looking for TB as doing a TB test. And it really isn't. Now, our primary screen for tuberculosis is a questionnaire with testing only used in people for whom it's likely to do good. However, there are lots of people with high-risk family exposures, high-risk travel history. I'm negative, of which I have to be to work for the health department, but I'm surprised to tell you that when we pulled out these new questionnaires and I took them among my own family, I found somebody with untreated latent TB. Just to give you a little background on what that means, you'll have to discard some things you've always thought were true. You know how people have that little scar on their arm where they've gotten BCG vaccine? Well, it turns out that that provides very limited partial protection for young children only. And the fact that one has had a BCV vaccination does not mean you should disregard a positive tuberculosis test, such as the skin testing later in your life. Now we know a positive skin test is a positive skin test is a positive skin test. And in people with travel and contact history or from high-risk areas, we will sometimes do a boosted test because the initial one can be negative and then the next time they react. Latent TB is a condition in which the individual has no symptoms, a normal chest x-ray, but a positive tuberculosis test. They are carrying TB disease, but it is not active. 1 in 10 of those people will develop active TB and become infectious to other people. We're really interested in catching it early, and now we have medications that can be given for just 3 months to take care of that state of tuberculosis. So it's really useful.
That's to deal with the latent
Yeah, latent TB.
and
So,
wipe it out, basically?
yeah, and we're really lucky. You know, in the world, it's very common to have tuberculosis, extremely common. In the US, it's not common at this point. We have the ability to get on top of it and stay on top of it here. And it's really important that people in healthcare, people who care for young children, or elderly or disabled or immunosuppressed people are careful to get the correct history and testing if it's indicated. It's also true that people with immunosuppressive or advanced medical conditions like cancer, uncontrolled diabetes, HIV, other conditions, the use of steroids, which it seems like every time you turn around, somebody's handing you a steroid. You know, if having muscle trouble, they give you a pack. You know, you've had sinus trouble, they give you a pack, and that can make you more vulnerable too. So we think there's quite a bit more latent TB than we are detecting. And I did go and take special training last December at the National TB Center in Florida in preparation for this, and recently sent our nurse manager and our TB coordinator for special training as well. So we're in good shape. If anyone is curious and wants to be screened initially with the questionnaire and testing if needed, you can roll right into the health department any day and we'll set it up for you.
Now, when you detect, I'm looking at your 63 TB control interventions.
Mm-hmm.
When you detect one, do you then check family, check other people around them to look for it? Is that part of the process?
We have legal recourse for treating active TB, but we cannot force people with latent TB to accept treatment. And
Okay.
so the problem is internationally, because up to a third of people in endemic areas are going to eventually develop either latent or active TB, a lot of people are going back and forth, decline to be treated. They don't understand that they are somewhat protected during treatment and that they still cut down their chances of active TB to less than the 10% risk they already have.
It sounds like one of the issues there is how do you find the people that need to be tested, screened, questioned, whatever the process is? I mean,
Well, country of origin, work-related contact, close contact with people who are symptomatic or at high risk because of travel history. For example, at colleges and universities that have heavily courted international students, it's not unusual to I mean, they did a workup of 1,000 students in Fairfax this year.
Is somebody with latent TB
Mhm.
infectious to somebody else?
No,
Only
by
if it's active.
definition, it's latent, it's not active. It,
And therefore not infectious to others?
that is correct,
Okay.
but you can't tell when you become infectious.
Okay, all right.
You know, today, your x-ray is negative, you feel fine, you're not coughing, the people around you are well and no one else is at risk, and 1 year, I don't know if that's a cold or the flu, or if you're kicking it into gear on your TB, you know?
Well, it's a, I guess, both curious and alarming number. I mean, TB is something that I think for the average citizen, including this average citizen, is completely off the radar screen. When I
Mhm.
think of TB, I think of my cattle, because that's
That's
one-
right.
one of the issues in
And
Virginia
ele-
used
it's
to
a
be
huge problem
declared.
for elephants.
I don't think of my elephant, but, you know, that used to be a big issue in Virginia, and it isn't anymore. But I compare the 63 there to the numbers on the next page for
Mhm.
STDs and all the other things. I mean, it's an order of magnitude
Well, and just think
larger
about,
problem.
up to a third of the world carries it outside of here, so paying attention at home is really important. So if you know someone who has a persistent respiratory illness, they should bring it up to their doctor, because I will tell you, as a practicing physician for 22 years, there was a period of time where people who were positive but felt fine beyond a certain age often didn't get treated at all. And now we know that we made a little mistake there. And it's hard to get that cultural adaptation by people who practice medicine. They, to this day, probably half of the physicians you stop and talk to will tell you if there's a BCG, you shouldn't do TB testing, you know, and some other things like that. So if you hear anything like that, have them call me up. I'll have a chat with them. And I brought some cards with me if anybody needs them.
I mean, let me ask the question this way, and I'm simply looking at the data on your
Have
first
I,
two
have I
pages.
failed to answer a question? I'm sorry.
Well, it appears, just from the numbers, that the TB situation is a far more pervasive and maybe of more concern than most of the other infectious diseases combined. I mean, is that a fair reading of, and the percentage increase, of course, is enormous.
Well, the
I mean, am
vaccine
I-
preventable diseases are hugely important. Influenza vaccine, pneumonia vaccine for vulnerable people and people who are older, things like that are super, super important. So I would think about what you're looking for as a multi-legged stool, and there's not like one thing that's your only priority. Latent TB, there's a 1 in 10 chance it'll activate. Most of the individuals among those numbers have latent TB. Only, and some people have agreed to be treated and some people haven't. The ones that you see in those numbers have accepted treatment. We have a variety of people who haven't, and some people have religious feelings about it, and you know, there's.
But even 1 in 10, that's 55 cases last year of TB using that statistic. That sounds like a lot to me.
Well, it is a lot, and it's something that deserves to be prevented and treated. And especially people who are gonna be staying in country. There's a good payoff for going through with the treatment, and it's shorter now. Also, TB control will bend over backwards. If there's somebody who doesn't have much money and has other problems, they have done all sorts of things, helped. If they've had to be isolated, they've helped them with their groceries, with their doctor visits, all kinds of stuff. They're really interested in making this work, and they also are providing the combination 2-drug therapy for latent TB free of charge currently. They won't have money for that forever, but that's something that we can do regardless of income right now.
Do we have a pretty good accurate count and location and identification of the MRSA?
You know, I'm going to sort of blow the lid off of MRSA here. I'm glad you brought that up. MRSA, or methicillin-resistant Staph aureus, is ambient among the population. As many as 35% of women who aren't ill and have not had any unusual contacts have it in their genital area. We have grown up with so much antibiotics being given to us in the food we eat and everything else that we've just bred a bunch of bugs who know how to say no now. So MRSA is important. if it becomes invasive, it infects the urinary tract, a wound, something like that. And I will tell you that all of those nice bottles of hand sanitizer everybody runs around with, there's several really important bacteria it doesn't kill. So soap and water is still the correct thing to do whenever you get the chance. Before and after you eat, before and after you go to the bathroom. It's sobering, isn't it?
Well, the only reason is we, at least some of the time, when we get, we're going to a patient, picking them up in the ambulance, we're notified if it's a MRSA situation.
Well, you've picked up people with MRSA quite regularly, I assure you.
And we didn't, and we didn't know it, and they didn't know it.
Yep.
All right.
Yep.
How do you feel now?
That's pretty scary, isn't it?
That's right. Well, watch you wash your hands before we eat.
So I think I'll leave you with that food for thought
Any more damn awards to shake anybody's hand.
and see if I can eject my car keys are on this, so I can't tell you how important they are to me.
Something we might consider as a follow-up to take her offer is diabetes, for example, is clearly something, and obesity and the things that go along with it. That might be something that's worth a further conversation at some point, just to see if there's anything that we can do awareness-wise. Because the test is so simple. As a matter of fact, I had one today.
Right.
And it took about 4 seconds.
But intervention should actually occur way before you get to testing.
I know this was part of another process, but it seems to me that there's some
You're
possibilities of an area.
Diabetes is a great case management target. So I think that would be a great collaborative project, and I can start looking for things that might be pertinent if you like.
I would be more interested in what we can do as a policy. I know we'd say make awareness and stuff like that, but that's still an education that's still indirect. Are there any ordinances I can pass
Yes,
that
I'm
is gonna solve the
planning.
problem?
You've got a lot of things at the planning level, and I'm gonna suggest when you all sit down with the regional commission, you should probably have somebody like me sitting there too. Because when you plan projects, you should have walkable places. You should have access to walking activities, parks, exercise stops, encourage the development of clustered living situations where people can walk to the little store or walk to an entertainment. And this can even be done in relatively small places. But it's very hard for people to find safe places to exercise. Where can you bike without getting wiped out? Where can you walk? Where can people who are older or have disabilities do the same thing? So there's a planning piece for you. And when you plan your roads and highways, take a look at that. Take a look at visibility and safety for pedestrians. There's a great program called Safe Walks to School called the Walking School Bus, in which parents and children actually form a chain and walk to and from schools within a certain radius in groups. So there's some great stuff that we can do right here, and it doesn't have to be expensive.
Thank you. Okay. Need to finish up a couple things real quick. The presentation of the certificates of election.
Thank you. We've come to give the certificates of election for Board of Supervisors, and is Ms. Pope here?
Yes, like that.
So, first for Mr. Johnson, come on up here and get your certificate. Did it. All framed and everything, thank you.
Doesn't he get 2?
Thank you for your service to the community.
Absolutely. Thank you. All right.
Yeah.
Thank you all.
Yeah, that's what I intended to try to get done.
We appreciate your service.
Otherwise,
Thank you very
I'll
much.
be
Thank
here
you.
for public hearings.
Thank you.
Thank you.
Thank you. And congratulations.
Thank you.
For condolences.
And
And And you know better, you've been here before.
Can't help myself.
All right, want to see if we can also wrap up the RRCSB, crisis intervention. Brian?
I'll try to be brief. Just an update, not that anything you have to take any actions on. Apologize, it's just an information piece here. I appreciate a few minutes on your agenda. Crisis Intervention Team, CIT for short, is, let's call it a branded model of collaboration between your local law enforcement officials and our mental health workers. And also to extend that a little further to other first responders. Crisis intervention training is a national model where localities make an agreement that their law enforcement officials and mental health workers are going to, when presented with a call to law enforcement that is primarily about the mental status of the individual, that this defines the way those two people work together, your deputy or sheriff and the mental health evaluator. And our region is in what I would call the formative stages of evaluating a CIT program for the 5-county area. And part of my work here tonight is just to kind of give you an update on that, give you a very brief orientation of what CIT is and why we're interested in it. So this is not new. CIT, like I said, is a national model, started in Memphis, Tennessee many years ago, several decades ago, as an outcome of a tragic situation between law enforcement and someone who was in a mental health crisis. Out of that grew a very structured training program for law enforcement officials and mental health workers that was successful there and has branched out across the country. In Virginia, the New River Valley area of Virginia was the first multi-jurisdictional case of a CIT program being successful in multiple jurisdictions, and those of you who are familiar with Virginia, New River Valley down the Radford, Pulaski area. And about 10 years ago, has been operating a very successful CIT program in that region of Virginia. And as of today, all of the neighboring regions to our region in PD9 have an active and viable CIT program. You find one in Charlottesville, and Fredericksburg, and Shenandoah. So here, we felt it's time for us to look seriously at this. And it's important for a number of reasons. It's important for, let's call it the human factors, and it's important because of the practical factors. The human factors, it leads to safer outcomes for law enforcement officials and mental health workers and the consumers, the individuals in need and their families. It is, on the practical side, it saves time and money because law enforcement officials nationally, we've learned, spend less time on these. Crises are settled more successfully and more quickly, and often resulting in fewer incarcerations and fewer involuntary hospitalizations because people have a structured way that they're dealing with these incidents that are leading to better and improved outcomes for the individuals. If just to give you a snapshot, some people say, well, how often is this really going on in our area? And so the second page of the handout gives you kind of a very global view. These are real first quarter numbers from July 1st of this year till September 30th. Very recent stuff. And these are calls coming into our emergency services. These are all mental health services calls. You look in the second column there, that's the number of face-to-face evaluations that we're doing based on a mental health emergency crisis. I have it there by locality, so you can look at Orange as it compares to other localities.
That's an average of 3 a day?
Yes, sir. That's correct. And then how many of those are resulting in involuntary hospitalizations? A significant number of those face-to-face evaluations, one of your law enforcement officials are accompanying the individual to the hospital.
Or it could be two if there's a violent.
Thank you. Very often it is two.
And on the transports to the hospital, most jurisdictions require 2 law enforcement officials. So this is why people listen to this, because anything that can help minimize time for law enforcement officials and improve their safety starts getting law enforcement attention. I'm taking on my role in the CIT development. I'm the chairperson for the CIT steering committee in our region, a very small and developing committee now. Chief Battle, who is chief of police for the town of Warrington, is kind of running this up the flagpole of his peers throughout the region for all local law enforcement agencies. So your Chief Amos has heard from Chief Battle. And so we are starting this conversation, kind of educating the locality about what CIT is. And we are hopeful that we can begin to see components of this coming together in the new fiscal year. A number of your local law enforcement officials throughout the region are CIT trained. They've gone to the training. Law enforcement chiefs of police and deputies have seen the value of this and have sent individuals to the training. What we lack in the region is a coordinated effort where all of our law enforcement officials are collectively trained, and then our mental health staff are trained, and we have a true kind of regional collaboration on this. So this is not new language for many of our law enforcement officials. And my role here this evening is just to say, this is what we're doing. And you're probably wondering, well, what does this cost? This is really a pretty cheap endeavor, as endeavors go. The Commonwealth has required elements for a successful CIT, many of which I've kind of already made reference to: training, collaboration among local governments and mental health and law enforcement officials, memorandums of understanding, these things you can do without spending any money. One of the required elements is a designated person that's known as your CIT coordinator. And that coordinator often works for the Community Services Board, but doesn't have to. They can. And that individual makes sure all the departments are trained, makes sure that protocols and procedures are followed up, keeps data to report to people like you about how this is going, and does follow-up on all incidents that occur. There's a database that they report to. So it takes one person to operate it. And of course, with that one person comes some expense. So there are some shared expenses that law enforcement departments, boards of supervisors engage to find a way in which to fund a position within the region. We are still developing. We have some models that I may present to you at points in the future about how that may work. I'm not here really to do that tonight, but the expense then is maybe $60,000 to $70,000 annualized across 5 county jurisdictions and at least 3 town jurisdictions. I'm presenting in a month. I'll be at the town council meeting for the town of Orange because this is an issue for them. So we've identified the 5 county governments and 3 town jurisdictions: the town of Orange, town of Culpeper, and the town of Warrington. This also affects the hospitals. The community colleges have law enforcement and deputies, but we're trying to spread this out so that when we get to a operational program, will impact where deputized law enforcement officials are interacting with individuals with a mental health crisis. And what I also attach there is a draft memorandum of understanding that could be some format of this would be a document that we would have among the 5 local governments preferably, and other jurisdictions involved in this arrangement in our region. That's the information. I want to see what questions you may have. There'll be more to follow on this. This was just an update. Yes, sir.
One quick question. Town of Gordonsville, are they?
We've made some just judgment calls about size and numbers and interest, and so that's why there's been no deliberate elimination. If any of the other towns wanted to participate, had law enforcement officials that wanted to training, they would be welcomed into this. Yeah.
On your training, do you include first responders beyond just the law enforcement?
We do, as a matter of fact, and I'm not surprised to hear that question from you, Mr. Frame. In this oftentimes involves fire department personnel and first responders rescue squad personnel.
We had one the other night.
Yes.
Does this program envision training all law enforcement officers or all first responders? I mean, it seems to me that you don't have the option of just training a few and making sure they're the ones that there. So it seems to me it's a training program that has to include all.
It does, and the model ultimately leads to having trainers within the region.
Sure.
So that there are shared resources. There are people within the region who can and do conduct the training. So you have it perpetuates itself once you have a critical mass trained.
You mentioned standard procedures and protocols in dealing with this for law enforcement. Could you give us an example of the kind of thing that that might not be obvious in terms of the dealing with them in a situation?
The training for deputies and law enforcement officials goes through, it's 40 hours, 5 days. Goes through a program of, let's call it Mental Health 101. Through the eyes of an individual experiencing a mental health crisis, what are they experiencing when an individual in uniform shows up with a gun, armed, oftentimes trying to understand a situation that has criminal elements, but there's no laws have been broken, who may feel that their safety is in jeopardy. And training a law enforcement official that when presented with that situation, the first response is not detention and physical contact, but is to stand back and to exercise what we would call de-escalation techniques. And these are verbal, these are posture, these are position in the room, these are how you term things. And so the training involves some very kind of real-time role-playing for law enforcement officials who are oftentimes presented with situations very different than this, where those type of tactics are the appropriate interventions, to know quickly when the primary presenting issue is a mental health crisis and the individual in need is probably going to respond a lot better to a very different approach from an individual in a uniform, which improves their safety, the law enforcement official's safety, and then just from there.
Mr. Chairman, member of the board, Brian came and gave a similar presentation to a meeting of county administrators from this region.
That's right.
I think this is an important first step in certainly the training, the education of all the first responders, but as you noted, as I quickly added, usually in these transports they have to go to the hospital because if there's an involuntary committal, there's a medical evaluation that has to occur before they're admitted. There are usually, if it's a violent act, it's in the emergency room, you need 2 deputies there. It's not a real good place to be doing this evaluation. Some regions have gone, they're already down the road, farther down the road, where they found in a cost-benefit analysis that it's better to build maybe an intake facility at a hospital to remove these evaluations from the emergency room setting. Then by freeing up the deputies to go back in service, and then this evaluation and all that has been taken care of on site at the hospital. We were just talking with the sheriff today concerning weather closings. There was an instance where it was 12 hours of taking somebody to Culpeper Regional. They were involuntarily committed, and then had to be transported to Petersburg, Central State. So there is a direct savings that could be achieved in freeing up our personnel. But we've got to start at this point of the training before we get down the road.
Well, I've been in an emergency room where you've got somebody who obviously got mental illness issues, and they're screaming and hollering, and I mean it's not very good for the rest of the patients there when they're exposed to that.
And I meet with the ER directors of both Culpeper and Fauquier. Let me tell you, they're polite and professional, but they say, "Can you please deal with this issue somewhere else? There's no business in my emergency room." And so there's a longer conversation as your county administrator is talking about The General Assembly actually will provide some funding for the assessment centers.
Huh.
They're
What
not
year?
gonna, actually, it was
Is it
in
part-
last year's budget. Whether it survives the biennium, I don't know, but,
Sorry, I had to take that.
we're in,
Sorry.
we're in the formative stages here now. Any other questions?
Thank you, Brian.
Okay, thank you.
Thank you.
Thank you, Brian.
Okay, last two things real quickly. Public comment. Do we have anyone signed up?
No, sir.
Okay. Then the consent agenda, if we could do that before we move into closed meeting.
Motion to approve.
Second.
Motion and a second. All in favor, say aye.
Aye.
All right, sir, if you would read the appropriate language and we'll go into
All right.
closed.
Whereas the Board of Supervisors of Orange County desires to discuss in closed meeting the following matters. Discussion concerning a prospective business or industry or the expansion of an existing business or industry where no previous announcement has been made of the business or industry's interest in locating or expanding its facilities in the community. And consultation with legal counsel pertaining to actual or probable litigation or such consultation open meeting would adversely affect the negotiating or litigating posture of the public body. And consultation with legal counsel employed or retained by a public body regarding specific legal matters requiring the provision of legal advice by such counsel. And whereas pursuant to sections 2.2, 3711A5 and A7 of the Code of Virginia, such discussions may occur in closed meeting. Now therefore be it resolved that the Board of Supervisors of Orange County does hereby authorize discussion of the aforesaid matters in closed meeting.
So moved.
Second.
All in favor, say aye.
Aye.
We're in closed. All right, we have recessed to closed meeting, so that we can come back and do the public hearings, at which point in time we'll go back again into closed. So, with that, let's see, which one is first? The proposed budget amendment and supplemental appropriation. For the additional capital school board. All right,
I don't have a big presentation, just a short introductory. A few remarks. I think by state law we're required to, just given the size of this supplemental appropriation. But I'll just point out 60% of this for carryover is attributable to projects that were in progress or started right after June 30th. So for capital needs that were being done. Another 15% of this is attributable to utility savings that are going to the debt payment for the performance contracting we negotiated and started last year. And then a majority of the rest of the operational savings are to be put into one-time expenditures, replacing the roof at Hornet Sports Center and replacing 2 school buses. But everything in this is all one-time expenses and isn't out of the ordinary. We've had this each year, this amount. So.
Does the 2 one-time expenses, I haven't done the math, does that use up all or virtually all of the non-committed funds to projects? Is that what I'm to understand?
Correct.
Okay.
The remaining balance.
I thought, I didn't do the math, but it looked like that was the case.
And that should help free up 2 years down the road for the sports center, for instance. That's on the CIP in 2017. So, but it's damaging the building right now in the condition it's in.
And the 2 school buses are those in the cycle for replacement now, or is this an acceleration of the cycle? I'm just trying to get a sense of what.
It's to try to get us to where we couldn't get to last year.
So it's catching up, basically. Okay.
okay. Thank you, Matt. I will open the public hearing. Do we have any speakers?
No, sir, Mr. Chairman.
We'll close the public hearing. Thoughts, gentlemen?
I move to approve the resolution.
I'll second. Okay.
A motion and a second. Any further discussion? All in favor say aye.
Aye.
Motion passes 5-0. Okay. Hearing number 2. Deborah, excuse me if I do this wrong. Huzo? Is that, am I saying it? Okay,
I think you were close, if not right.
special use permit for bed and breakfast.
I'll try to be brief. She has property at 6007 Governor Barber Street, she's in Barbersville. She has an existing accessory dwelling on the, above her garage on the property. She wants to rent that out as a B&B with a two-person maximum occupancy. Staff's recommended approval of this based on the comprehensive plan. The Planning Commission heard this on October 16th. They have also recommended approval with the, let's not get too many papers. With the minor change to the staff suggested conditions, which removed the one specifying the requirement for the drain field to be certified by an AOSE. But other than that, the three standards that they recommended were that the approval of the special use permit will be transferable to other property owners. But any expansion, which is customary, would require an amendment of the SUP. There's a food service permit that the Virginia Department of Health has. They'd be required to obtain that. And they would also be permitted one sign for the site, which would be 16 square feet maximum and would not be illuminated internally.
Is the reason you deleted that on-site soil evaluator for the drain field because they were gonna need that in any case to get their get permission from the Virginia Department of Health?
The way staff originally worded that would make it a condition of zoning permit issuance because the drain field on site is over a decade old. But to answer your question, it would be regardless.
I mean, if the Department of Health asks for it, they've gotta do that whether it's a condition or not.
Well, they're supposed to. Yes, it is under state code. They do have to get that. But the onus of compliance falls upon the applicant.
Falls upon who?
The applicant.
According to the application, the property was under contract, but not yet owned by the applicant at the time. Do you know if there's been a closing at this point? Or?
She has. She is the current owner.
Another thing, building or portion of this building, this is uses. A building or portion of the building where the compensation lodging is provided for 30 or fewer days in 12 or fewer guest rooms or suites. And I'm looking at their application and they say for no more than 2 guests. I'm not sure what this means.
That was just citing the definition under which they would be permitted. So that's how we currently have a bed and breakfast inn. That's how it's defined in the zoning ordinance. So we merely just.
So if they want to build on and go up to 12 guest rooms and 12 guests, they can do that?
No, they're gonna come back and modify the SUP.
Any expansion, they have to come back.
Right, it's for 2 people in existing period, no more.
Well, as I read this, it says 12 or fewer guest rooms.
But I think that's superseded by the condition.
Right, that's the ordinance that she falls under. And then she is applying for one. In fact, she was even asked at the application, why just 2? She said, what about a third? She said, no, I'm, as far as a child or whatever, she said, no, I'm just interested.
I understand, I'm just trying to look at what the documents say here. Because, 3 years from now, that's the only thing that'll be there.
Right.
And the documents as submitted with the application. So I guess maybe the fact that, this concept plan that she submitted, does that become a permanent part of that record?
Yes, sir.
And that says no more than 2 guests?
Correct.
Where is the language on the condition?
It's, condition number 3, uses.
Somehow I lost it.
we could strike that sentence from there. I mean, it's not necessary to be particularly where it is. I could see how it could
It
be a
just-
little confusing.
It just it added confusion to me. If you're comfortable with it and our attorney is comfortable with it, I'm not gonna have any big issue with it. It just was confusing to me.
I believe that's a definition, correct? Not a,
Well, that is the definition. Mr. Frame is not incorrect that this could be interpreted to give the full access, because the actual conditions, if you look at the resolution, the approval ordinance, it says it's approved subject to the 4 conditions, which are these 4, and these don't list that limitation. And so it would be possible for somebody in the future to interpret it differently than the limitation of the 2.
So if we delete that statement, then it goes back to back to item 1, controlling documents shall be in the conditions set forth herein and the documents as submitted with the application, which has that limit of 2.
Right.
So I would think we ought to pull that statement out of there.
question.
It doesn't add anything, it doesn't hurt to take it out.
Is there any other use that a 2-person bed and breakfast would fall under?
Not under our current zoning ordinance, no.
I guess the other possibility is under number 4, the performance standards, where it says approval of this special use permit shall be transferable to future property owners. But any expansion of the use beyond the original application, maybe we should say 2.
I don't have a problem with that. I just delete that section where we say a building, or that basically the description in the,
Yeah. But I'm just saying
for
for
number 3.
maybe we go ahead and say the number we're approving is 2.
That's fine too.
Well, what you really need to do is just under uses, this SUP should permit a bed and breakfast in, period, and then just strike the rest of it.
Yeah.
You don't need to actually pull in the bed and breakfast in definition, Josh, see what I'm saying?
But I think Lee is right, given that that language is in the ordinance, I would feel more comfortable if we actually used her number from the application in one of the conditions, since she's in agreement with that.
And keep
Oh,
in
I mean, that, I would imagine we could go back to 100 special use permits that have been approved, that could be, if they wanted to go back and see if they were approved for an automobile repair shop, just as an example, they might be able to go to the definition and pull out something, but I mean, SUPs are governed by the conditions you put on them. They're not governed by the definition of whatever business they're in the ordinance.
Right, because we allowed where a junkyard had been, it became a salvage yard under the old SUP.
I mean, this is provided for 30 or fewer days in 12 or fewer guest rooms. I mean, it's not saying all bed and breakfasts get 12 guest rooms.
Well, I don't know why we need to put the definition there, because
I don't know either, but I'm just saying, I don't think the fact that we do means that they can then say, well, that's what they've been approved for. I think that's just not reasonable.
I would make the motion that we approve this SUP application with the one amendment of changing item 3 to this SUP shall permit a bed and breakfast in, period.
Period.
Strike the rest of that paragraph.
You're not gonna leave the main house shall be occupied?
Why don't you, can I make a suggestion, Mr. Chairman? Bed and breakfast in, comma, and subject to the application submitted, subject to the terms of the application submitted. That way you're buying.
he already says that up in item 1. I like
The
your
item one says controlling doc-
statement there. I don't have a problem the main house is occupied. I don't think that makes a lot of difference.
I will include after the period, the main house shall be occupied by the property owner.
I don't have a problem with that. I'll second that motion.
Public hearing.
Yeah, we gotta have a
Oh,
public
I know.
hearing first, so. Okay, so that's what y'all would like, so, Thank you, Josh. Is,
I do not see the applicant here this evening.
you do not?
I do not. No, sir.
Okay. In that case, I don't think she'll speak. So I'll open the public hearing. Do we have any speakers?
No, sir.
Close the public hearing. Now, I heard a motion.
Yes, you did, sir.
And a second.
Okay, any further discussion? All in favor say aye.
Aye.
Motion carries 5-0. Hearing number 3. Mark Wheaton, Stephen Hine on behalf of Memorial Foundation of the Germanic Colonies. Do we have anybody to speak for our side, or?
He's just gotta get his file.
Paperwork, it's government. Lots of paperwork. This application, SCP 14-07, is for actually special use permit to construct a library museum, which would be behind the Germanic Colony's existing visitor center, just before you get to Culpeper County on Route 3. What they're proposing is a 2-story building with a basement. It's approximately 40 by 85. It'll house a number of things from exhibits, archaeological finds. I believe there's going to be a theater on the 2nd floor, which is proposed. Staff have recommended approval of this application based on the comprehensive plan and our intended land use in that particular area of the county. This also went to the Planning Commission on October 16th. And as with the previous SUP, they've also recommended approval to the board. There were a number of performance standards. Mr. Chairman, do you want me to read through every one of these?
I don't think we need to,
Okay.
unless y'all need to hear.
I had a question on 4F. I'm just trying to figure out what it says. Site layout shall ensure that any downspouts are disconnected.
I had to get clarification from our plan review on that as well. Basically, that means rather than the downspouts being discharged into a central storm sewer system, they're just dispersed onto grass. I think it's a confusing way of putting it, but once he explained it, it made sense.
I don't know how they get to a rain garden if they're disconnected, but if that's the right word, fine.
No, well, that would be, that would be a LID.
Low impact design.
But you gotta get them there somehow.
Yeah, but it doesn't mean all of them have to feed into one. So,
Okay.
I got real familiar with that.
Yeah, I bet. The term disconnected just threw me out.
I have a question. One of the recommendations from the Department of Historical Researches was a Phase 1 archaeological survey. Was that, what was the discussion about that?
I'll let the applicant address that a little further.
Okay.
Basically, when they got their conservation easement for the parcel that's just north of their property on Route 3 there, they had to go through, they had to do an archaeological study of some sort. And I think they did a number of digs, both north and south of Route 3, and there were no findings. So
All right.
staff didn't feel like it was worth it to put it as a condition,
Okay.
but the applicant would probably know better than I.
One question I have, Josh. Under the performance standards B, there was discussion as to the fire suppression. There are alternative fire suppression avenues out there. By putting this in here as it's written, even if they were able to do one of the alternative systems, it would be an astronomical amount of money for them to hook up to RSA's system. Had there been any thought given to rephrasing that so that the correct fire protection was provided rather than just?
I think they did not want water suppression. They wanted to use something because they were afraid that that would destroy their artifacts.
And that's what I'm saying, is the way it's written currently, is they're being required, if they
Yeah,
need a fire
gotcha,
suppression
gotcha,
system,
gotcha.
it has to be of the H2O type.
The building shall be required to provide an adequate fire suppression,
Right.
not necessarily hook up to RSA.
Right, and it doesn't necessarily have to be a water system, it could be a halon or a halon equivalent.
Yeah,
Because I forgot what the dollar amount was,
it's expensive.
it, beyond expensive, yeah.
Well, the rationale behind that particular, performance standard is just based on conversations with the building official. He said it's highly preferable to have a public water supply if you're gonna have fire suppression. So based on his comments in that regard, we put it in there as a staff proposed condition. That's,
So you think that he would not approve some other alternate, fire suppression?
I do not know enough about the building code to answer that. Afraid so. I think given the, water supply in the area and the size of the parcel, I think they could probably get away with an alternative system, but
I'm just thinking, even if they had the water, they may not want a water fire suppression system under any circumstances.
Right, I mean, there's many fire suppression systems out there, they could put redundant systems in for significantly less that you would find in any large office building or a lot of the historical, buildings that are done. I hate to see it being, if they can go with an alternative system, I sure hate to see it say.
They still have to
hook up to the water.
On one of their, site plan renderings, they talk about a well with a 10,000 gallon storage tank,
they do.
which seemed like
Right,
that ought to get close.
right.
So, I mean, I don't know, it's the only place I saw it, I don't know if that's still the plan, but.
Staff, I mean, we have no qualms about removing that condition. That was just based on conversations with the building official.
And we can let the applicant discuss it as well.
Yeah.
Anything further, Josh?
That's all I have, Mr. Chairman.
Okay, well, in that case, we'll hear from the applicant.
Thank you, Mr. Chairman, other supervisors. I'm Steve Hine. I'm the Chief Operating Officer of the Germanna Foundation in Locust Grove. And we're pleased to be at this point in our foundation's nearly 60-year history to submit this special use permit application to construct a new building next to our current visitor center there on the property. This is also the 300th anniversary year of the founding of the first Germanna colony, so it's very appropriate for us, we think, to be at this stage in our history and do this. The new building will be used to house an expanded genealogical research and history library, as well as additional educational and interpretive space, and some archaeology laboratory, curation, and collection storage space. And it will be dedicated in honor of Alexander Spotswood, who founded the Germanna colonies and actually whose portrait hangs in the old courthouse right here in Orange. The building will also incorporate several distinctive German architectural features, so it will serve as a complement to our existing visitor center and a visual icon to passersby and visitors in the area. And we just hired a full-time staff archaeologist who started about 2 weeks ago. So we are well on the way in our mandate to reactivate the archaeological exploration and interpretation of the Fort Germanna and Enchanted Castle site right across Route 3 from our current location. Regarding the fire suppression system, we are concerned about the cost if we will be required to establish an RSA water and sewer connection. The current water system we have is well water with a 10,000-gallon capacity tank and a pump system, which is sufficient for the water and sewage, and we have a septic system, and that's sufficient for the planned capacity of our current building and the new building. So the question really is in the fire suppression arena. And we would like to investigate dry fire suppression systems, particularly for the new building because of the concern of the collections, particularly if we have rare books in the library section of that building. And the cost, I know we have some varying estimates, but it's probably between $160,000 and $300,000 to establish the connections is what we've been told by RSA in our discussions with them over the past 2 years, which would be a significant cost, obviously, to a small nonprofit organization like us. So that is certainly a concern. And what was the other?
The other was the archaeological survey.
Oh, the archaeological survey, yes. The site that we are looking to construct the building on, what has already been disturbed when we built the visitor center 15 years ago. So we don't think there's any concerns there. But with our staff archaeologists now, if we need to do an archaeological survey, we would be able to accomplish that relatively easily and with our in-house
You're not required
archaeologists.
by Department of Historical Resources to do so.
DHR did not
So there's really nobody
require that, that's
There's
correct.
nobody requiring it. Okay.
Is this a one or two-story structure?
It's two-story with a basement.
I don't have any further questions.
Calculating something, Jim, or?
Yes. I was just wondering because I know that the Elwood Manor over in the park system is fully sprinkled with an on-site tank that I believe the tank there is only, it's either 1,000 or 1,500 gallons. And that is for initial fire protection. It is meant to be supplemented by the fire service later on, but having worked in that industry for quite some time, I believe that there's many alternative systems that they can probably go with that will provide the protection that they need without damaging. Because water damage from the suppression systems is usually more damaging than what the fires
Fire
end
itself,
up being.
yeah.
What is the structure going to be constructed of? Do you know yet?
We don't know yet.
Okay. Because that would also have an impact on it for you if you went with
Right.
A steel frame structure, steel walls.
Right.
And then your facades or whatever under wood. That would greatly cut down on your fire
Right.
risk and everything and what you'd have to.
Okay,
All right.
thank you.
Thank you.
Okay, open the public hearing,
No speakers.
close the public hearing. Thoughts?
I would like to make sure that we incorporate in this, not just the water supply, but if there's an alternative available that the building officials deems sufficient, that requirement be vacated for the mandatory connection.
So that if he deems that there needs to be a system, then the alternate system is acceptable in lieu of connecting.
As long as he would provide the, and I'm sure that he would probably go with an outside engineer most likely to certify it. Be my
It seems
guesstimation.
that we need to reword that
We
performance
need it.
standard number 2 and
Do we need it at all? I mean, if the building inspector says he's gotta have a fire suppression system, he's gonna demand that as a part of the building permit process. So I'm not sure we need it as a special use permit condition. Well, I would make the motion, we approve this, deleting that item.
I'll second that.
Okay. Any further discussion? Hearing none, all in favor say aye.
Aye.
Motion carries 5-0. Okay. Hearing number 4. Proposed amendments to the Orange County subdivision ordinance. Josh.
Anybody showing up to do, help your archaeologist yet?
Well, yeah, we have about 8 or 9 people that
Oh,
have
yeah?
volunteered to help out.
Okay. Seems rather cold weather to start hauling
Yeah.
dirt, but anyway, okay.
This public hearing is for an amendment to our subdivision ordinance. This amendment does two things. First and foremost, it reflects changes in the state code that became effective July 1st of this year. Those are related to preliminary plats, and when the county can require those. The other major thing that we've been wanting to do as staff is to remove all references to 5427, which was the old 1 in 4 division policy, which was declared void by the circuit court in 2012. So that being said, you have 7 pages or so of a draft language. The Planning Commission made no changes to this language at their October 16th meeting, and they've voted to recommend approval. So I welcome any questions or comments about the language at this point.
The definitions, I didn't have a chance to look. Are those, in some cases, new definitions that are included in this text amendment, or I was a little puzzled as to what and why I was reading those.
Some of them, I take particular issue when we reference things in an ordinance and do not have definitions for them, because that creates ambiguity. I don't like it.
So do I agree.
So the definitions you see, if they have a parenthetical reference afterward, then they were taken from another area, either from our ordinances or from the state code. Or alley in particular was a determination by an old planning and zoning director. Lot depth, public street requirements, and reserve strip were both new. Oh, and survey was just to see the definition for plat, since we do reference survey in there.
Any questions? Jim?
No, I think
Thank you, Josh. We will open the public hearing.
No speakers, Mr.
We will
Chairman.
close the public hearing. Thoughts? Motion?
My thoughts are that I'm very happy with the way things are coming forward to us. Very good thought process, a lot of hard work to get these things to the point that they're at. That's
So
my thoughts.
you would be making a motion? then?
I will make the motion to accept these and move forward.
Okay, I have a motion. Do I have a second?
second.
Okay. Any further discussion? All in favor say aye.
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 Motion carries 4 and 1 begrudgingly.
At least one, yeah.
We were on the other side of this, 5 years ago, 6 years ago? Sorry to believe it.
I wondered why it took so long to second that.
I was coming for it, but, okay, with that,
I should
then
have given you the opportunity to do that. I wasn't quick enough. Sorry
we'll
about
go
that.
back to the
I was
regular.
thinking those two were gonna be the ones making the motion.
Yeah, that's
Second.
I'm chairman, I'm supposed to wait till last. Okay,
Chairman,
move back to
we
the,
have a closed session to return to as well, so.
yes, I mean, we'll go ahead and get this here, and that way these people can do what they wish. You'll just wait around forever until we come back and go.
And he won't tell you anything that's gonna be any good to you.
He always waits for the certification.
Yes, he does.
Okay, next would be the Department Director of Constitutional Officer reports. Don't see any. County Attorney report, we have none. County Administrator's report.
Yes, sir. Given the lateness of the hour, I will move very quickly through the three reports that I have.
We thank you for that.
First is the Regional Public Safety Communications Roundtable. As you all know, we've engaged in a process with our adjoining localities, Albemarle, Fluvanna, Louisa, Madison, and Orange counties. We're all at some particular point in having to implement or design, develop, and implement and finance new public safety communications. There seems to be a great deal of interest and collaboration, and we're moving forward with starting those conversations. I'm also pleased to note that Nikki Tidy is going to be facilitating a working group of all the technical folks, and
Good.
she's definitely taken charge of that process.
That's the right answer.
So, next, gentleman, is Tourism Economic Impact Study. Mr. Jay Billy, Chairman of the Tourism Advisory Committee, was going to be here tonight, but had some work-related issues. His email went down, and that's not a good thing for a bed and breakfast. So he was going to come here and report. The survey should be launched this week, and you see it's on the letterhead. There's a universe of maybe 125 businesses that have been identified as key target. And I think Mr. Billy would share with you that he'll personally go and deliver these letters or come close to it to drive up participation. So at this point, we'll launch it. We should wrap it up before Christmas and then get into the analysis phase. So, Mr. Franklin, I think I've covered everything's working well with that group. Last is the Germanna Wilderness Area Plan. This may be the last update, at least for the board part of the steering committee's work. Next week at Tuesday, December 9th at 6 p.m. There'll be a joint meeting with Planning Commission Board, EDA, to have a briefing on the working draft by the steering committee, and at 7 p.m. Another public briefing. And we've done everything we can to publicize that event, trying to garner some attendance. Then there will be a public comment period. The steering committee will be working through over the next 30, 40 days. And with that concludes my report.
Okay.
I think they're gonna be televising or recording the presentation. So that Channel 18, I've already had several people say they couldn't make it that night and wanted to see it, and so Allison apparently has already arranged that when I called him this morning.
Good. Quality employees ahead of you.
Yeah, I like it. I like it when they're in front of me.
All right, next we'll move on to new business. Budget reductions.
As you all know, we received, and you saw the request, the offer of how we could to transmit back about 72,000. I'll let Glenda, if she could, speak to kind of the mechanics of where we're going to give this local aid to the state.
Sure. We did get the official notification about the amount that the state would be requesting for cuts in the current fiscal year. And for us, it is 3% of what they consider our base. So we had thought at one point that it might be 3% annualized, but since it would be starting in January, be half of that amount, but it's 3% of the entire annual amount. So a total of about 72,000. And once again, they have given us some options about how to pay it. what the county has done in the past is just taken reductions in the revenue for each program. And what I've suggested is that maybe just to leave a little clearer audit trail is to actually do a disbursement for this amount, you know, code it to an expenditure line. I mean, it really is a refund to the state, and we have an organization within the general fund called Refunds. So that's just a suggestion. You know, I could be whatever the board chooses for it to be. But you know, I think we all know that there's probably going to be more to come for fiscal 16.
Could we return monies from unfunded mandates?
I noticed one of the other things that in the list that might have an impact on us was they're cutting 70,000 out of the regional jail. But I talked to them and they said they're gonna just eat that. They're not gonna buy some vehicles, as a result. The other thing they said was, they wanted to do the same thing, sending the money back, because they didn't want to set a new lower bar for the revenues.
Right, that's kind of my feeling about it. It gets lost when it gets netted out of the revenue.
And then and pretty soon that becomes the standard from which they make the next round of cuts.
Well, the other thought I had is that if we do send it back in a lump sum, then it puts us, I think, in the position of looking at each line item and deciding what, if any, or how much to replenish. Makes that job easier, because we might decide not to give it back in the same proportion that's listed on this state report. I see a few items I'd like to talk about.
As
Some of
far
it-
as what we're going to do to
make it up?
backfill
Right.
these particular budgets.
I mean, there's a downside in doing that in a few cases, but not in all cases, as I understand it.
I'm not sure.
So that's another action to come back to the board on how we're going to offset these reductions or.
Well, I mean, the way it was presented here would be to take the funds from contingency to be able to then fund this payment back to the state.
As opposed to as opposed to decreasing money
Within
to
the
the registrar, the
departments.
court services and stuff like that.
Right, because what we had done in the past was more or less backfill with general fund revenues. We had not really gone into the individual departments and made those cuts.
I mean, you could do that and then replenish the contingency with what you drew down from the individual departments.
If you did that.
If you did that, yes, sir.
Right.
Well, for something like the biggest number in there is the CSA program. That's 45,300 of the 71. That's big. I'm not sure we're going to have a lot of choice in terms of what we have to spend on that. That's pretty much jammed down our throats.
Right, and it is a function of what we spend.
Oh, that's
so-
right. That was the example I was gonna use. In past years, not every year, but the past couple of years, I think there's been, that program's been under budget. If I remember correctly. And so that might be an opportunity to not do a peanut butter set of adjustments, but to be selective. That's really the only point I was making. You don't like peanut butter, I guess.
It's sort of off the subject, but just to kind of, why did the state do this? State's budget is $47 billion.
Because they could.
30 million is 0.00063% of the budget. I bet more than 30 billion is going to be spent by all the state employees who are chasing this around, and all the local employees chasing it around, and all the paperwork that's being for $30 million. It makes no sense whatsoever. I know, realize it's no one's fault here. I'm not angry at anyone here, but it ridiculous to me. I mean,
Well,
at 30 million sounds like a lot of money, but spread across all localities in Virginia and based on what Virginia's budget is, it just doesn't make any sense.
I think you raise a good point, and Thursday night, at least some people that sitting up here are gonna have an opportunity to meet with our two representatives at the state, and I would hope that all of us hit that squarely. Cause I think you're absolutely right. I mean, frankly, it's a joke or an insult. Pick whichever one you like.
Mhm. Perhaps both.
I mean,
Perhaps both.
you know, maybe they could take our new road funds.
I mean, my response is gonna be, you gotta be kidding.
Exactly. It's just, I've been asked, a number of folks have been trying to figure out what the rationale was, because 30 million is a lot of money. There's no question, it's taxpayer dollars. But to give you the range, Fairfax County is $2.1 million out of a $1 billion budget for Fairfax County. And $19,000 is coming from Cumberland County, which probably has a $40 or $50 million budget. So the scale of this to get to $30 million is proportionate, but $30 million in a $48 billion budget, and the overhead that has been spent to collect all this, it just, I can't find the rationale other than they can do it.
I mean, they could have, I mean, I said this already, but it makes no sense. And to the extent they wanted to pull something in, they could have done it in the next budget. There was nothing, 30 million is such a small figure for the whole state of Virginia that there was nothing, exigent about getting this done right now. It was almost kind of to me, it's almost like a shot across the bow there.
Well,
We can do this, you all better, watch yourselves.
when we saw the budget briefings, that sounded like it's more than a shot across the bow, it's a shot through the bow.
They're preparing us.
This is the warning shot. Break out your swashbuckling sword.
Get out your pails and start bailing.
They're preparing us, I'm looking at Mr. Benefield right now, because we have work through, because they're going to probably come after schools.
Don't spend all that extra money, we'll let you keep. Just a
Yeah, we
warning
may
shot.
want some of that back too, so don't spend it.
All right, I make the motion to approve this.
I'll second it. Any further discussion?
So we're approving, taking it from the contingency fund, is that essentially what we're
That's
approving?
correct.
Okay, yeah, that's fine.
Okay.
I would just add, and I would also like to have a discussion at some later date as to what adjustments we make to our various line items in the budget, rather than peanut butter it, as I said before. Let's at least have a discussion about, or hear recommendations from you, whatever the case might be. I don't think it's necessarily the right answer to take 3% out of every one of those line items.
Well,
That's why we did.
If we're taking them out of the contingency fund, then we're not taking it out of any line items.
Right, but the plan is to not take it out of the line items currently, but we might.
Revisit this matter maybe at the first regular meeting in January to look at
Budget.
at how some of these funds may be recouped.
We could do the same thing the state did.
Yeah, I'm sitting here thinking, why would we do that? I mean, we're gonna decide to take $348 out of this line item and $2,498 out of this line item. I don't see it's a good use of our time. I mean, I'm not.
Well,
We've luckily, I guess we've been fairly conservative with the contingency fund. What did that start out with, by the way?
We haven't used it.
It was started out at 350, I believe, or
350,
325.
Okay, so, I mean, we've gotten through, half the year without taking too much out of it, so that's good. I mean, I'm not trying to make, it's all tax money and we all, we don't wanna spend it needlessly, but
I mean, if CSA
given the
comes
scale
in-
of things, even on Orange County's level, I mean, 72,000 is, I'm not sure it's a good use of our time to go through and try to portion it out to a bunch of different line items.
I mean, if we see the CSA coming in at a lower than budget, we'll transfer that into the capital fund at the end of the year.
All right, just something that simple, I'm not
Yeah,
saying.
if it's something that I could see there could be it would make sense to do that at some point if there's some money that's, I don't know how to put this diplomatically, but, yeah, that would be a good example of it.
Carry forward, if there's a carry forward,
There's an unexpended balance.
That is in your financial policy, I
Yes.
think.
it is.
Yes, Jim and I will be talking about that.
Okay. Motion second. Any further discussion? All in favor, say aye.
Aye.
Okay. Old business?
Yes, sir. Mr.
Capital
Chairman,
Improvement
members
Program.
of the board, you have before you the final document of the proposed CIP. In my board report, I've reflected all of the changes that have been made to date. I appeared, as you all requested or asked, directed me to do to the school board last, it was a direction. Last Monday on November 24th, I provided copies of, and briefed the school board, particularly the pertinent sections. I would characterize their reception as certainly very approving, and that they appreciated the process that the county is going to unify this approach to including school projects as part of it. As far as the timing of those projects, they certainly understood that trying to come up with a phasing as part of the CIP for this CIP was maybe not practical, and would look forward to working with the board subcommittee or some grouping of board members and school board members on working on the phasing and getting the timing of the school master plan into the CIP between, say, January and August, when we get ready to update it again. Finally, Mr. Johnson, Mr. White have been working on financial policies, certainly with Glenda and myself. I can certainly represent that the CIP as it presented tonight is consistent with those policies, and the plan is to bring those policies forward at a work session, the work session on December 16th. We're meeting next Tuesday just to finalize those up. So right now, I think at this point, everything is in a position for you all to take adoption, to adopt this, and that this would then conclude this aspect of our capital improvements program, and it would ready us for the capital budget that would be coming forward with the operating budget.
I'd like to say that including the debt service and identifying monies for new or future debt service in the CIP was very helpful in terms of getting a complete view of what was going on. I think that's a significant move in the right direction. As a matter of fact, one of the policies will deal with that, but I think that's a positive change. It certainly made it a lot easier to see where we really stand and to look forward to the budgeting process.
I move we adopt it.
Second?
Motion and a second. Any further discussion? All in favor, say aye.
Aye.
Motion carries 5-0.
Thank you, gentlemen.
Okay, board comment.
Yeah, I have one thing. I think Brian distributed the comments I had on the Governor's Commission on Ethics. They have come out with a revised report, recommendation. One thing changed. Under the original draft, they had said that the limit was $250,000, or $250, $250 a year to an individual, which included his spouse and any kids that were living in his home. And it looked like that was cumulative for all people. Well, that would, 2 birthday parties would probably exceed that limit. And they have changed it to $250 from any one individual, which is a little more reasonable. But it also includes the intangibles. But there's a whole bunch of other things in there that I'm not particularly happy with. and I'm gonna revise my notes to accommodate that one change, and that I propose that I provide that and discuss it at the legislative dinner.
Very good. Absolutely agree
All
with
right.
you.
I have a couple of comments I'll make them quick. First, I'd like to, since the members of the press are here tonight, I'd like to thank both of you for your recent articles and discussions about the Route 3 initiative. I thought it did a good job of summarizing where we are and sort of setting the stage for the next step. So I point that out largely because of your involvement in the many meetings over the past year that you came to get the background in order to be able to write those stories the way you did. So I appreciate your commitment of time as well as the treatment. The other one, since we're talking about money, I'd like to, for those of you who might have missed it, I heard it driving in here today. As a country, we set a milestone today. Our debt went over the $18 trillion number. And I decided to do a quick calculation. If we were in a position to stop borrowing and start paying it back, if we paid it back at the rate of $1 a second, it would take us 571,000 years to pay off $18 trillion.
How about if we did $2 a second?
I guess that means
Even better.
if we did $1,000 a second, $1,000 a second, it would still take us 571 years.
Well, we're less than 250 years old, and we managed to assemble a debt of $18 trillion in less than 250 years. So paying it back in 571,000 seems to be just about right.
So, we don't expect it to be done before we're finished paying taxes?
Probably not.
Well, along that note, but on a positive side, all of the work that has been done by the Route 3 Steering Committee, you gentlemen, everybody else, the staff, the amount of money that we have saved by doing this in-house has gotten the attention of a lot of the residents, and it's very positive, the ones that I've talked to. And everyone is to be commended for that because in a day and age where everybody just wants to spend money and figures it's an unlimited resource, as we work very hard to spend the money intelligently here in this county, this is truly a wonderful cost savings that everybody has put forth an effort to accomplish. Also, just so everyone knows, the airport, who some of the citizenry thinks that it's a big waste of tax dollar money to have a county-owned airport and run airport, now has another business, Noble Air. Zach Noble is the owner of it. He is the only locally licensed sightseeing company in the air. He is a veteran helicopter pilot. He currently flies for a medical helicopter, and this is what he does on his days off from that, and is very dedicated to Orange County and the development of the airport, which has been a wonderful thing, and there's just a lot of good things going on out there. Thank you, sir.
I might mention that doing it ourselves, but a lot better understanding of what's going on than
Here, just write a check.
yeah, I mean, the
Yeah.
drill has been worth it in itself.
Well, it's allowed us to guide ourselves to where we want to be. So,
I would just say, this is the first meeting that I've been at since the election. I thank the residents of District 1 for giving me this honor for the next 3 years, and I will try to work with all the residents of the district for the best interest of the district and for the county. And I look forward to doing that for the next 3 years with you gentlemen.
well, we're glad to have you back.
Thank you, sir.
Absolutely.
Okay. The only thing I would have is, what I was asked earlier today, when are we going to decorate the buildings?
The hallway out there is decorated.
The hallway's wonderful, but no, what I was asked was our presentation on Main Street, since we are a major player, and we're sort of dark.
I'm sure Mr. David has ideas that he was going to bring to the board at their next meeting.
I
to address
Well, I
that.
don't know if I may have enough time to do that. I may have to make some executive decisions, so.
Well, that's what I meant.
Okay.
You're gonna tell us afterwards.
I will quickly huddle with the appropriate folks on staff, and we will light her up.
I do know community development is decorated.
I did have a suggestion that the courthouse might like a wreath and a spotlight. It is a wonderful asset that we have, so.
Can the state pay for that?
I doubt it. I'm sure they'd have to write us a memo that would cost $10,000 for us to appropriate $100 for lights, so. Okay. Onward and upward, informational items. Nothing. Appointments to boards, commissions, and committees.
I am working with the school board to help us locate some library board members.
Excellent. I would like to make an appointment. I would like to reappoint Hannah Kappas on the Economic Development Authority.
That's a good one.
Any others? Okay, with that, all in favor say aye.
Aye.
Okay. Well, y'all would let the town know that Hannah's been reappointed. Calendar. Scheduling a public hearing. Everything good on that for the 13th? No complaints, I assume so. Okay. With that, that concludes everything we have in open session. We are back in closed. For those of you that like to sit around, we'll be back, Dan.
Promise you will follow the rules. Promise we'll follow the rules. Ready?
Yes.
Yes, sir.
Alrighty, to the best of your knowledge, were the only matters discussed in the closed meeting, public business matters lawfully exempted from open meeting requirements, and only such public business matters as were identified in the motion by which the closed meeting was convened were heard, discussed, or considered in the closed meeting. Roll call.
Mr. Johnson?
Aye.
Mr. Goodwin?
Aye.
Mr. White?
Aye.
Mr. Crozier?
Aye.
And Mr. Green?
Aye.
That was my turn.
Aye, aye,
All right.
Mr. McFarland?
Lee's been the reluctant voter tonight.
There's only one order of business left, gentlemen.
I move